most formulations are in Malayalam only, but these products are getting away, and these yogas are very small. You can produce by yourself and you can give for your patients. So if any doubt, you can ask me regarding the yogas. So first we will see some of the cases, and its explanation and all we will see afterwards. And this is to give some awareness regarding what are the cases you can treat by using Agada yogas. Actually, by hearing Agada, we are thinking this Agada is only for Vishachikitsa. So Vilvadi Guliga, when you are hearing about Vilvadi Guliga in the second year, actually we are starting the Chikilsa from the second year itself. Because first the Chikilsa, what we are studying in second year is Agada Dandra, no? In Vishachikilsa, all Jangama Visha, Stavara Visha, Kritrima Visha, everything. We are starting our Chikilsa from the second year. But I think after second year, just we are leaving that. We are not at all using the Visha medicines in our clinical practice. So, not only in Visha conditions, but in all other conditions where we can use these Agada preparations. Okay. First, we will see some of the pictures. This is a case of Mandali Visha. Mandali Visha is a viper bite. Viper bite ulcer, actually it is a non-healing ulcer. Even though if we are treating, it may get healed, but after some times again, the wound may get open, and maybe doing for some of skin graft, but again it may fall off. Actually in allopathic system, there is not a clear treatment for this viper bite management. And actually when we are studying in our PG days, we have posting at allopathic hospital where there is this anti-venom they are giving and the dialysis unit and all. Actually, after that, we conducted a seminar at our college department, and we invited the doctors from different allopathic hospitals who they are doing this management. So with our medicine, how can we manage the viper bites? It's very nicely by the Visha medicines, you can treat it very well. Because all Mandali Visha itself, our Acharyas are telling, it become Dushtavrana. And for the Dushtavrana, the Mandali Visha Chikilsa can be adopted. And we'll see what are the medicines afterwards. Okay. This again, actually this is a case, it's an accidental case. And it's a multiple fracture was there. And here also, the non-healing ulcers, it become non-healing ulcer. Actually, in Charaka Sutrasthanam, you can see that when an Aganduja Vrana, after some days, if we are not treating well, that's changed into Nija Vrana. In the Nija Vrana also, if the dosha involvement will be more, it should be treated as a Visha. And the context of Visha. Like that Charaka Sutrasthana it is telling. So this Dushtavrana, it is an Abhigadaja case. After that we treated with the Visha medicines. So by the OP medicines only, it got healed. So we'll see the medicines afterwards. It's again a Mandali Visha Chikilsa. It's in Mandali Visha. In the malleolus, it's non-healing. It's also getting healed. It's a varicose ulcer. Actually, it's very, very common nowadays, the varicose ulcers, and very difficult to cure also. Actually, for that, we have to increase the, we have to clear the channels of venous system. Srodhoroda we have to treat, and so we have to select some Ushna, Tishna medicines, Vivayi Guna, Vikashi Guna, such property medicines. You know, all the Vishas, these having this, the medicines of Visha Chikilsa should be ashukari in nature. It should be act very fastly. Then only we have to treat the poison's condition very fastly and very effectively. So all the Visha medicines, it's having at least that Tishna, some of the medicines, okay? Tishna Guna, Vivayi Guna, Vikashi Guna. So these medicines we can use to remove the Srodhoroda from the venous system. That's why we can clear the venous system. After that, what we have to do? We have to make the bella of the valves of the venous system. Then only we can assure the correct movement of the blood flow in the venous system. These are different stages of that vrana. This Jivaraksha Gulika we are using for treating such cases. It's a Malayalam yogam. I will show you that this actually healed. It's another case of varicose ulcer. It's another case. This condition, no, in the case of venous ulcer, before getting to an ulcer, this dermatoliposclerosis condition. Because what is happening in a venous ulcer, actually the venous pressure increases. Because of that, for protein and white blood cells will leakage from the venous vein, and it makes a barrier along the under the skin. So no nutrients can be reached from the vein particular area, and also this area cannot take the nutrients from the blood. So such area become black in color, necrosis happens, and here also breaking the barrier which is forms because of the deposition of the lipids and white blood cells. Again we need to use some arthrosclerotic changes, because to remove that, again the Shrodhoroda is there. So in such cases, our Saptasaram Kashayam, we are using for the Kadishula. Saptasaram Kashayam, when we are seeing each and every drug of it, it will be Tishna, Ushna, Vivai, Vikashi and Ashugari Guna. So in the case of venous ulcers and for the varicose vein, Saptasaram is the best choice. But what is the Anubana for Saptasaram? Padu, Kana, Hingu, Ajyam. Padu is the Saindava, Kana, Pippili, Hingu is, Hingu, you know, Ajya, any that ghee preparation. So after removing this Shrodhoroda, that's because of while using Saptadaram Kashayam, Gugulu Panchavala Churnam, again it's in the Nadi Vrana it is told, you can use that. And along with that, after that Deepana, Pachana, Shrodho, Shodhana, if you are using any ghee, Gugulutam ghee you can add to this. Or Maharaja Prasarani Thailam you can add. Or Sahajaradi Avarti you can add. So that way it reached vein in the particular area, then can be treated. And also the best drug to treat the arthrosclerotic changes in the venous system, that's Arjuna. It's a single drug. So Arjuna, you can just make a kashayam and you can take, or make the Sukshma Churna of it and you can mix with any of the kashayas and take. It's the best drug to treat the dermatoliposclerosis conditions of the venous ulcers. It's another case, it's a bite case. Actually, it's an old lady, and at the time of COVID, she just came to our OPD, but we couldn't see her properly. By the phone only we treated her. Actually, first it was like this. Then when she approaches, when she reached, that was the condition. And afterwards, we gave the medicine by the phone only, and her grandchild, he is sending the photos to the phone. And afterwards it's healed well. But here all we are using this. That's the importance of using some of the medicines or Visha medicines, and also the local what we are getting in our OPDs. Not only Visha Chilsa, but also the common Chilsas we are using. This is another case, charcoal food. Charcoal food, you know, it's a complication of diabetes. What's happening in the charcoal food? First, it will change the shape of the food, and this arch of the food, it may get loose and the food becomes so flat. And while walking and all, where there is a pressure points, there forms the ulcers. And at the same time, the bones starts to degenerate, will break up, and it may shed off like that. And it may, the charcoal food end up in an amputation. Okay. Here you can see, he knows that the thumb, this was the condition when he reaches to OPD. Actually, when he came, he was wind up the case with some oil. She went some local Vaidyas, he went some local Vaidyas, and they did some pijus, and he came to OPD. Actually, when removing that, it was very foul smell with the maggots inside that. Actually, maggots in a wound is a healthy thing, because these maggots will eat up the slough and always give a chance for a new cells to generate. So first we cleaned it well. Second feature after healing. And last, okay, please. Actually, when at the time of discharge, this was his condition. And this is the back side of that, that leg. And also there was a hole you can see under the thumb. And through that we can visible his bone over there. Because our acharyas are telling, no, when it is krimija vrana, dushta vrana, ashrayas of vranas, tokashrayam, mamsashrayam, astyashrayam, like that, it's a so deep wound, cleaned it well, and we did piju with the parandyadikeram. Parandyadikeram is told under mandalivisha prakarana in the case of non-healing ulcers. So we did that piju with that, cleaning, and kshalana with Karanja is the best drug to treat Dushtavrana. I think Karanja is very common here in these areas. So it's Karanja Patra is the best choice. You can make the Kashaya and do the Kshalana for the Dushtavranas. It's a Vrana Shodhana, Vrana Ropana, and also it's a Vishahara Drivya also. If you are not getting Karanja Patra, always, so you can make as a Rasakriya. You can make as a Rasakriya preparation. And you can make use, you can keep in your clinic, and whenever a patient is coming to you, you can do the dressing with that Karanja Rasakriya. Okay. And we did Dubana at what told in Pranachilsa Yavari Jurna, and after that changed to Kugulu Panjavalam. Piju. And that's also healed completely. So, with normal medicines, if you are using Visha medicines, the action will be very fast, and it will reach the area very fast. Whenever you are choosing a medicine to treat a particular condition, what you have to select, along with any medicines you are giving, you have to select a Sthanika medicine also. When you are, if you are taking, if you are giving any medicines for like any Ashmeri and all, if Ashmeri Bhedaka Drivyas you are giving, along with that if you are using the Bhatyari Kashayam, it will directly take that medicine to the particular area. So when you are anyway you are selecting a medicine, give an importance for the Sthanika action drugs also. This is a condition of psoriasis, that erythrodermic psoriasis. Actually than a normal plague psoriasis condition, erythrodermic psoriasis condition having a problem, that is the pitta involvement will be more. Normally, the Sigma conditions is associated with the Vata and Kapha, but in the case of this, Paitika involvement will be more. That's why whenever with a small change in the diet, reverse the conditions very fastly. And than the itching, the word Sora means itch. So psoriasis itself means a disease that with the more itching. So in this case of erythrodermic psoriasis cases, than itching, what you can see, it's a burning sensation. Burning sensation will be more in such condition. So treating this condition, you have to give more emphasis for the Pittahara drugs. In the case of Pittahara, here also, for treating the Visha, we are focusing more on the Pitta. So Pittahara drugs, the Vishahara Drivyas having more action. The first picture, when she was admitting in the hospital, she was an old retired teacher. She is vegetarian. But what is the problem with her is she is taking more this acidic foods always, but akala bhojanam also. These two again increases the pitta. So even though she is a vegetarian, when we are coming a psoriasis patient, while going we are telling you should be in good pathya, don't use at least 3 months for the non-veg food and all. But you have to see that how these kadu rasa drivyas increases the pitta. The same way, if she is using pickles, if they are not taking the food at proper time, again pitta may increase and causes the increases the condition. So here actually we had given the Rajavrikshadi Kashayam and all told in Shajilsa, but ending with the Guluchadi Kashayam, Sudashana Gulika, Vipatti Churna, and Kshira Kashaya Dhara we did externally also. Guluchadi Kshira Kashaya Dhara. What is the problem with her? Actually 6 years back the same patient had psoriasis history, and at that time she took treatment, and that doctor ended up that case with the Mahadikta Gradam. So actually now, second episode of this condition, without asking to the doctors, she started to take again Mahatikta Gridam. She thought that first when she took Mahatikta Gridam, she cured it completely. That's why when again, if I'm taking Mahatikta Gridam, this condition can be cured very fastly. But one thing we have to think that Kushta Roga is a Sandarpana Vyadhi. So in any sort of Kushta, there will be increase in the clay tattva. So if we are giving again ghee without proper deepana, pachana, shodhana, rukshana, this ghee again changes to the, increases the kleda in your body and the condition may increase. And also don't give snehapanam with the Mahatikta Gridam in the case of Kushtarogas. Because Mahatikta Gridam, it's contained, that's amalaki juice, it's a rasayana dravya. So if you are giving Mahatikta Gridam for the snehapana, again the kabha in the body increases, kledatva increases, the condition may get triggered. So if you want to give the snehapana, better to give Tikta Gridam, Indaganda Gridam, Arakuta Mahatikta Gridam. And as a pravicharana snehapana, you can use Mahatikta Gridam. Okay. This is again another condition of erythrodermic psoriasis case. But in this, the plaques will be more. More increased pitta, more burning sensation than itching. And all this skin will flare off very fast. What is happening, the pathology of a psoriasis is, we have a 28 days of cycle in skin shedding. But in the case of a psoriasis patient, the temperature of the body may increase very fastly and the maturation of the cell may happen within 4 to 5 days. So it will fall off very fastly. And some pustules also. Pustular psoriasis is again another form of psoriasis. There also the involvement of pitta will be more. Here also we can use the Vishachikilsa drugs. This is a time of discharge. This is another case. It's a person who is a driver, heavy vehicle driver. Actually, he told that he has a history of this psoriasis when he is an adolescent age. But he don't know that was an psoriasis case. Actually, it started as a dandruff. And he took many treatment for the dandruff. It is not subsiding. So many of the patients of psoriasis patients is coming to our OPD, same complaint that we have dandruff. So how you can differentiate them? If in the case of a dandruff, when you are examining the scalp, you can see that small white silvery flakes, very small thing you can see. And while combing or something, it may fall off very easily. No inflammation you can see under the scalp. So examine very clearly each and every case, okay. If it is coming as a psoriasis case, what we can see, when you are combing, when you are taking off the flakes, little bit small bleeding spots we can see. That's we are calling it as auspich sign, underlying bleeding spots. So check it for before giving the treatment. The same presentation you can see in the case of seborrheic dermatitis. Seborrheic dermatitis is the area where more sebum is getting producing, and that sebum area it shows as a dandruff itself. So here what is the examination? You just scrape the area. That time you can see it just greasy wax like scales you can see, because sebum is a snigdha dravya. So while scraping that snigdha dravya along with the dead cells, it forms a greasy appearance. So in such condition, don't give any sort of oil application to the head. If a patient is coming to you as a dandruff or a scalp psoriasis or a seborrheic dermatitis, if you are giving oil for the external application, the condition may get worse. So examine it very clearly and then only prescribe any oils for the external applications. Okay. Here, this is the case. He treated it as a psoriasis, dandruff, and when he reaches about his 20s, 25, he starts to shed, and he couldn't go outside. He's not going with their friends. They are telling, you know now, when we are admitting a psoriasis patient with a common normal patient, very next day they will come and complain to us. Doctor, we couldn't sit over there, his flakes are coming, while putting the fan, it will come out, it's fall to our food, we couldn't eat food. So many complaints they will tell. So before admitting the patient, you should give counseling for the co-patients because they have to give them more psychological support. Even any psychological stress, the skin condition may increase very badly. So it is not a contagious disease. It won't spread from one person to another person. It's only the fast maturation of the cell. So you have to counsel, you have to educate the co-patients, by the psoriasis patients also. In such way, actually this case, whole body affected. Actually first photo I was missing. And just like very thickened patches when he is coming to that, but he was very alcoholic, he is a smoker, he is a gudka chewer. All Dushi Visha Lakshanas we can see over him, Avipagam, Ariti, no Agni, and Arade Sopna Darshanam, and his wife left him, and nobody is taking care of him at home. And during his housewarming, he couldn't participate. He was mentally so much depressed while coming to OPDs. And first, actually, any disease, any skin disease or any Vrana case, any Visha condition you are getting, first you have to give, if the dosha is Prabhuda. Prabhuda doshanam, what is the treatment? Is Shodhana is indicated. So you have to give Ruksha Virechanam, so as to remove the kleda from the body. So Padola Muladi Kashayam is the best choice. Padola Muladi, actually you have to take the churna, Sukshma churna, you can make the Kashaya, and the direct Kashaya you can give. Because Padola Muladi tablet or Padola Muladi bottle Kashaya won't give such a drastic purgation. So Sukshma churna, you can take 10 grams of powder, you can just boil with 3 glasses of water, reduce to 2 glasses. You can strain it, 1 glass at the evening, night at bedtime, 1 in the empty stomach. Only rice gruel is indicated with the black gram. No other food is indicated, nothing. Okay. And ask the patient to take more green gram because actually for the Padola Muladi Kashayam, as it making more Rukshatva, Mamsarasa is telling us Anubana. But in the case of a Vrana case, in the case of a skin conditions, we couldn't give Mamsahara because it is abathya for such a Vrana patient. So, instead of that, Alpavadam Snigdham, one drug which is pathya for Vrana Rogi is Mudga. So, you can use Mudga Yusham or Mudga Sekari or anything as much as possible they can. So, it's give a protein, it's a give an instant energy and also good pathya for this condition also. So 6 to 7 days. Actually it is telling Shadratre for using 6 days. But according to condition you can give 7 to 10 days. Along with the Kaishora Guguru Gulika you can give. It will give a complete Shuddhi of the body along with Rukshana. After that, if again Agni is not getting common proper, you can give Vaishwanara Churna for Agni Deepti. What is the significance of Vaishwanara Churnam and Hinguvajadi Churnam? Vaishwanara Churnam, the drugs having Deepana Pachana Guna, Hinguvajadi also, or Ashwajuna also having Deepana Pachana Guna. But is why we are choosing Vaishwanara Churna in the skin conditions or in Vrana condition? Because as it contains Haritaki, it's a Pitta Rejana in nature. So Agni Vritti Deepana Pachana Pitta Virothi is Vaishwanaram. But if we are using Ashtachurnam or Hinguvajadi Churnam, Deepana Pachana Pitta Vritti. If Pitta Vritti is there, again the condition may get triggered, itching will be more. Okay, so better to choose or Vaishwanara Churna. So in this case, for Snehapana, we use Kalyana Gridam because Kalyana Gridam it told in Dushivisha Pragaranam according to Sushuddha. As he is an alcoholic, he is a gudka chewer, he is a smoker. This Kalyana Gridam is best choice for the Snehapana purpose as it removes the Visha from the Dushi Visha from the body. So after that, the normal treatments we did, Kashaya Dharas and Abhyangas, Ushma Sveda. Before the Ushma Sveda also, if better to, you can choose Haritra, Karanja Patra, Tulsi Patra, Nilini Patra. You can make the Kashaya of these things and you can make use of the Ushma Sveda. These Karanja Patra and Nilini, again it's a Vishahara Dravya. So after Snehapana, we did the treatments and this is another condition of psoriasis. It's a plague psoriasis condition. Kabhavada will be predominant in this condition. So Kabhavada Hara Aushadas, you can make use for this. This is after treatment. This is another case of, again, it's a Dushi Visha Ukta, psoriasis, Ega Kushta we can say. This is a condition, actually he is a patient from Goa. Actually before that, before getting this disease, he was an alcoholic patient and he took treatments from Goa and actually somewhat subsided with Ayurvedic medicines. And afterwards, he developed psoriatic arthritis. So for that psoriatic arthritis, when they started Dhanyamla Dhara over there, so whole conditions getting increased. And whole body is affected, all joints get swollen, and they are from there to Kerala for the treatment. So coming, this was the condition. All joints is affected. You can see the changes in the fingers, phalangeal changes. And this is after Snehapana. Okay. This is at the time of when we are getting discharged, this patient. This is after 3 months of follow-up. Actually, they went, we give medicines for 3 months and we ask them to send a photos. Now only phone we are seeing them. Next, last year also they came for the treatment. And here all there is a importance of using Vishadravyas and also our medicines. When to choose the medicines, that is the importance. With some of the very simple medicines you can treat them, but first one you have to keep on asking the patient. You should be a very good listener for your patient. You just ask, take the case very clearly, find out the dosha, which dosha is predominant. If you are maybe may not be able to find a name for such disease, but you can, what you can see, you can understand the dosha behind this. And for the dosha, you can give the treatment. Okay. If a patient is coming with the Mukhadushika, a pimple, and if you are just giving as a Varanadi Kashayam, maybe she is associated with the PCOD, you are giving medicines for PCOD, you can treat. But if an inflammatory acne is coming, then dosha will be different. In the case of a Mukhadushika, Kaphavada will be the dosha predominant. You can give Varanadi. But if an inflammatory acne, the dosha predominance will be Kaphapitta. So this changes to Guluchadi. So just examine the case, take the case very clearly, then only you chart out your treatments. So first comes the Vilvadi Gulika. I think everybody knows the Vilvadi. And the second year maybe studied well. And the indications of Vilvadi Gulika also you know. So, you know, first one, Bhujanga Luda Unduru Visha. So from the Phalashruti, what this Bhujanga Luda Unduru Visha, directly it shows the action on the Visha. Second one, Visujika Alasa, Gerajvara. This Visujika Alasa, these are diseases that pertaining to the GIT tract. So any disease, if you are getting any ajirna, if you are getting any food poisoning, you can give Vilvadi Gulika. Okay, Geram. If any Kritrima Visha is entering the body, again you can choose Vilvadi Gulika. Then Artan Naran Bhuda Vidashidamsha. What is the meaning Bhuda? This Bhuda can be microorganisms, any microbes. Okay. That's why any new disease is coming, H1N1 is coming, dengue is coming, COVID is coming. Our first choice of Gulika, that's will be Vilvadi Gulika. Why that? It's telling, it's an Agantuja Vrana. In Charakacharya, what he is telling, in an Agantuja Jwara, what the treatment, Vishajam, it's Vishaj Chikitsa you have to give. That's why we are, whatever the new disease is coming to us, we are choosing Vilvadi Gulika because it's an Agantuja Vrana, we are Agantuja Jwara, we are giving, and Vilvadi Gulika is the best choice for that. Again comes in as Manasika. So again these Bhutas, we can consider this as Grahobhadrava and we can connect to the Manasika Rogas. You know, in the, I think in Unmada Nidana, Charakacharya is telling Ashuji Bhojanam, Viruddha Bhojanam, like that all Aharas, Visha, first line of Unmada Nidana, he is telling like that. So if an Unmada, it is happening because of this Viruddhahara, Vishahara, Ashuji Bhojana or any drug induced, anything. In such a psychological condition also, you can use Vilvadi Gulika. Not in all Unmada I am telling, but you find which area, why, because it's happened. If there is a Visha involvement, you can choose Vilvadi Gulika for that. So many patients, maybe they are coming to OPDs, they're having a history of Viruddhahara. So you can use Vilvadi Gulika, almost all cases. Okay. And so, as a Kaya Chilsa patient person, you can use Vilvadi. As a Kaumara person, as a Visha person, as a Manasika person, you can make use of Vilvadi Gulika. And nowadays, studies show that if a person having an idiopathic epilepsy, there is a chance of the CME virus will be getting cytomegalovirus is the positive. If they are checking the IgG or IgM of CME virus, it will be positive. That one studies show that it in trigger, if the mother having the torch infection or the baby, anyways, any chance of the genetically it can be shown. In such cases also you can make use of Vilvadi Gulika. Okay. And actually it is telling that for the multiple dose, if we are giving Vilvadi in GAT infections or like any conditions, multiple dose, as a single small dose you can give, it will be more effective. In the case of Ajirna, in the case of Isujika, any Ama Visha, half Gulika or one tablet thrice or 4 times in a day you can give. And it is telling that how much, Vilvadi it is telling Sushma Pishtam, you have to give that much bhavana you have to give. Actually in commentary also we can see that 1 year bhavana, it is not possible. At least 3 months of bhavana you can give. How much it will be, we are giving bhavana, that much it will be, the potency may increase. Acharya is telling before, Acharya is telling Anjana Pana Nasya. Okay, this use we are using. So for the Anjana, it should be very Sushma Pishta, otherwise it may irritate the eyes. So that much Pishta, that much bhavana we should use. And the main use nowadays, any Kidadamsha we are giving Lebana, but Lebana is not a, actually Anjana Pana Nasi only he is telling. Anyway, we can use, no problem. While dosha analysis, we can see that Vilvadi Gulika is Kaphavada Shamakam in nature, Krishna Ruksha in nature, and same thing. Nirvisha Agada. No Visha Agadas are in this. So, I'd say for any babies or an adult, any condition, you can make use Vilvadi Gulika. Okay. Another yoga is Visha Vilvadi Gulika. It's available marketing. That it along with Vilvadi Gulika, this Nilini, Patha, Ishwaramuli. These drugs, I think in Parashnikala they are producing this and marketing this now. And these 3 drugs acting as a catalyst. So it increases the potency, it increases the action of the Vilvadi Gulika. And some of the pharmacies, they are adding Ashwagandha to it. As they are adding Ashwagandha, there is a chance of Rasayana also. So Uddipana, Pachana, Vishahara, attend as a Rasayana also we can make. So, Vilvadi Gulika, any autoimmune conditions you can use. It's very potent to make the antibodies negative. Okay. Okay, next. Next comes the Jivaraksha Gulika. Jivaraksha is a Malayalam yoga. You can see in Prayoga Samuchaya. And this contains Mangam, Rasam, Hingulam, Manashila, Haratala and all. So with the proper purification only, you have to make this. And I think in Kottakkal College they are making this for their OPDs, and also from one Vaidya is there, he is a registered Vaidya from Nilambur. Actually we want, he will give us this. Actually I am taking from him and he is sending me by post. Jivaraksha Gulika, as it is contains some Vishadravya's. So we should see some Vishas. In Savisha conditions, it gives more result. If a Dushivisha or Garavisha or any suspecting poison condition, you surely Jivaraksha Gulika will give you very good result. Its a dose is actually 1 gram tablet, 1 BD is enough, or 1 BD is enough, but pure pathya should be there. Only milk we have to give. Milk, kshira and kshira anna you have to give for at least for 10 days. No other foods. Else you can give all vegetables should be cooked with the haritra and small shundi powder. That's enough. no other food you should give, but it gives a very good result even in the gangrenous condition, which is told amputation. So even from such condition also we are getting result from Jeevaraksha Gulika. So any long-standing condition, any diabetic foot ulcer, any non-healing ulcer, you can make use of Jeevaraksha Gulika. It's Vadakabha in nature, Vadakabhara in nature, but as it contains more Visha, is contraindicated for children. Taruna Bhaskaram Gulika, again a Vishahara Dravya. As a rising Taruna Bhaskaran, a small Bhaskara, is a small riser, the rising sun. That actually from a person is going to die, if from that condition we can make him to awake, we can give life for that patient. Such a potency drug is Taruna Bhaskaram. Okay, this is marketing you are getting available. And in such autoimmune diseases and multiple sclerosis conditions for the pain management, and this is very useful, and motor neuron disease also you can make use of this. And in the Jwaradhikara, Brahmidrakshadi Kashayam is telling, if we are giving this tablet along with Brahmidrakshadi, I am not telling you have to use Brahmidrakshadi, but according to the condition, you can select Drakshadi Kashayam. You know, Drakshadi is a multiple action drug. And Drakshadi is Vata Pitta Shamana, and Drakshadi can be used in all autoimmune diseases, all Devanapachana conditions, all idiopathic conditions. The same way you can make use of this and take the case well and find out the dosha. And this one Taruna Bhaskaram is giving, it is getting good result. And this also, if a serious ill patient, after getting stabilizing the patient, Taruna Bhaskara can be given for a fast recovery. Okay. Kottattagaradi Kashayam is again Malayalam Yogam, we will discuss it. Along with this Kashayam, if you are using Taruna Bhaskaram, that's very good for the poisonous conditions. So, Pittadhiga, Vada, Rekta conditions, you can use this. Sanjeevani Vadi. Actually, this is not practiced in Kerala. We can see this in northern part of India, they are using well. But same indication of Vilvadi and Vishavilvadi Guliga you can see in Sanjeevani. But the ingredients having some Visha Drivyas are inside this, not practicing clearly. But the indication is the same thing. Then Pavitra Vadagam. This is a Virechana Dravya that is using in Agada. This for Virechana also, and this is for the antipoison. Vishahara Dravyas also we are using. Resam, all the Visha Dravyas are. No, Virechana is a Vamaka Dravya, and Prabhuda Kabha dosha is there. You can make use of this Pavitra Vadagam. And you know one thing, whenever we are telling that there is a chance of, there is an involvement of Dushi Visha, what we can see? Dushi Visha you studied, no? You know the sloka? Can you tell? The Dushida Deshakala Anna Adiva Sopna. Sure, very good, very good. From that, what you have understand? Dushida Deshakala Anna. It increases by Dushida Kala, Dushida Desha, Dushida Anna. Okay, what is that indication? When a season, when a patient is coming to you, they are telling, and doctor, I am having an allergy. When I am dust is coming, I am getting an allergy. When I am traveling from here place to another place, from there I am okay while coming back. In the outside India, I am okay while coming back to India. I am getting again these allergy conditions. Doctor, I am getting these foods. When I am taking these food, I am getting wheals like urticaria lesion. From that, what is we are taken understand? This is a Dushi Visha. So the poison, because of the Anna, Viruddhahara, or the poison which is not completely eliminated from your body, which stays in the body with the proper Desha Kala. Whenever it's a favorable condition comes, the Visha increases. It causes some Lakshanas. So the same thing you can see in all of allergies. So all allergic reactions, any allergic asthma, allergic rhinitis, allergic skin lesions, there should be an involvement of Dushivisha. So your treatment should be based on Dushivishahara. So Deepana, Pachana, Shodhana, it should be end up with the Dushivisha Chikitsa. Then only, whenever a person is affected with the Dushivisha, if we are checking his blood reports, there is a chance of elevation the IgE. Immunoglobulin should be elevated. Not in all condition, almost 90% of the condition, the immunoglobulin level may get increases. What is increasing? Whenever an immunoglobulin level is increasing, there is a decrease in your immunity. So you have to treat not for the allergy, you have to enhance your immunity. You have to boost your immunity. Then only you can prevent the allergic reactions to your body. You are taking maybe prawn, that may cause allergies. You may take any sea foods, it may cause allergies. So if you have immunity to prevent that, it won't make a problem. That's why Acharya is telling, if I'm a Viruddha Ahara Bhoji, Asatmya Ahara Bhoji, if he is good Agni, he is doing good exercise daily, this won't make a problem for him. It's act as an Ogasatmya for such patients. Okay. So, what are the things? So, all allergic conditions, all the conditions which is recurring in nature, there is a chance of Dushivisha behind this. Okay, you have to focus on Dushivisha Chikitsa. Murvadi Agata, actually it is told in Garavisha Prakarana. That's also you studied. Garo Bahada Pavakaha. What is that Garo Bahada Pavaka? Pavaka means the Agni, the Garavisha, the Kritrima food. Yes. So any food or any Kritrima Visha, anything that reduces Agni, and this Agni, that Garavisha, when it reduces Agni, it causes so many diseases, and for enhancing that Garo Upahada Pavaka, for enhancing that Agni, Murvadi Churna is the best. I am using more Murvadi in my practice for the Deepana Pasana purpose. Malpamaradi Kashayam. In avascular, some of 5 cases we have done with this Nalpamarada Kashayam in the avascular necrosis cases. It gives good result, and externally we did Kshiradhara with the Karaskara also. And along in the case of avascular necrosis, after proper Deepana Pachana, along with this Kashayam, Gugulu Tikta Gridam in a Taila form we administered. Okay. Then Nimba Delavadi condition, this Kashayam is very commonly used in Kerala. Actually, this is a preparation, it's told in Ayurveda Pharmacopoeia of India. And Nimba, Swarnapatri, Ashwagandha. Actually, for after proper Shodhana, Ropana, if a long-term Kashaya intake is needed. Actually, in Charakandol, he is telling a long-term Kashaya is contraindicated, he is telling Madhavan and all. But we are giving, they are taking. Okay. But if this is a safe choice, as it contains ashwagandha, it won't increase much vata, but acting as a rasayana dravya also. And commonly, if a swelling and painful condition is coming to you, Shigru Purannavadi Churnam. Shigru Purannavadi Churnam actually explained in Kida Visha. Shigru, Purannava, Manjal, Vayampa, Chandana, Padha, Ishwaramuli, Ishti, Shirisha, Nirinyil. These are the drugs. So making churna of it, you can make the external application with the normal water. If you are suspecting any bite, you just take tulasi leaves, just make a paste with water, and along this water, if we are applying the Shigru Purannavadi of the affected part, the Kida Visha, the swelling, the pain may subside very fastly. So in the first condition of cellulitis, Amavastha, you can use of this. And Arkapatra Sveda. You know, Arkapatra, you can take a bunch of Arkapatra, you can just make 2 tries and cut it to piece, and with the Grida, if you are giving Svedana, if the cobra bite associate with the swelling or any Kida Visha swelling, it's very useful. In gout conditions also you can use. And the Nimba, Karanja, Nilini, Panchanga, if Nilini is not available also, Nimba and Karanja, this Dhara, it's very effectively you can use in the case of varicosity. Varicose associated pain and swelling, the Dhara with these 2 drugs, it gives good result. And erythritol is not markedly available things. Cellulitis is very common. So we are considering and treating it as a Brana Shobha. In the first Amavastha, cellulitis person is coming to you, you can treat them. In the Pachimana Avastha, if a person is coming to you, better to refer because it's very fast spreading. Or along with the antibiotics we can treat. Otherwise we can treat, but we have to tell that patient. It may take some time. We have to convince them because afterwards it may get swell up, it may break, the water will come. Then the person may think its condition is getting worse. Educate them, counsel them, and you can treat. Else, you just refer them for 3 or 5 days of antibiotics after that. In the Pakwa also we can treat. And this Kottam Tagaradi Kashayam, Mustara Machadi Kashayam, Neeli Tulasyadi Kashayam, Nalpamaradi Kashayam is very useful. And in Chikilsa Manchari, in Trishna Prayoga, one Kashayam is there. Chukku Tuva Parpada Musta Kulur Chunda, Chinna Kottam, that's a Malayalam yoga. Chukino Shundi, Tuva, that's Dusparsha, Parpada, Musta, Kulur, that's Chandana, Chunda, Chinna, like small Kandagari, and Dhanika, Padola, equal portion, Kutikwadam Bendu Pebetayan, Sita, Trishna Munje. It will reduce the Trishna very fastly. The same way this Kashaya can be used in the cellulitis condition to prevent the next stage. To the Pachimana Avastha, we can make sure we can treat by the Amavastha itself. So Shida Pittam, there is food allergies or any contact allergies, urticaria lesions you can see in as a, we are calling it as Shida Pitta. But Shida Pitta is Vadadigam Shida Pittam. Kabham Udardanda. Kapapitta Pradana Udardam. Vadadigam Shida Pitta. So what you can understand from there? Vadadigam Shida Pittam, all physical urticarias, cold urticaria, hot urticarias, any mechanical urticaria, dermatographism. When we are scratching some portion that like that you are seeing, when you are writing some name of such an urticarial patient, the name will you can see. Such eruptions all we are considering as physical urticaria. So all are Vadadigam. So we have to give more importance for the Vada. Snehana Svedana Prayogas, Indaganda Krita Snehapanam you can give. Okay. But it comes to Udarda. Udarda is Kapha, Udardam to Kaphadigam. Acharya is telling like. So Kapha is more involvement in Udardam on the urticarial lesions. So Kapha Pitta Hara Yogas we have to adopt. So in Sahasra Yoga, if we are seeing Kapha Pitta Kulakadi, Amrita Vrishadi, Amrita Rajanyadi, everything you can see. All these things are explained in Visha conditions also. So what Acharya is telling is under Visarpa Vispoda Prakarana, it is telling these Kulakadi, Amrita Rajanyadi, Amrita Vrishadi, etc. So when we are hearing Visarpa, Vispoda, the main doshas coming to our mind is Pitta. Okay. Then why this Kapha Pittadiga condition we are using Kulagadi or Vishara Drivyas? Because as he is telling, Visarpa is a roga which having the Sarpana Subhava. That's spreading from one part to another. That we can consider as Visarpa. So any particular disease which is Kapha Pitta predominant in nature and having a Visarpana Subhava, that is Udarda. That's why in the conditions of Udarda, Koda, Udkoda, we can make use of this Amrita Rajanyadi, Amrita Vrishadi, Kulagadi, etc. along with the Dushi Vishari Kuliga. Okay. This Koda, Udkoda you can see in Chati Veda Vigrahanam, Adoga Amla Pittam, Dushi Visham, Tridiya Vega of Visha, Manda Visha, Sandarpana Vyadi, Sandipada Jvara, everything this Koda, Udkoda you can see. So all Vishahara Chikilsa, if needed you can adopt Panchakarma Chikilsa also. So in all these conditions, it is associated with any allergies. If you want to give Vamana, Sadhyo Vamana or classical Vamana, you can make use of this Vasha, okay, Padola Vari. And also for the Tribhala, Kashayam for the Virejana purpose. And single drugs that can be used in the case of Shita Pitta Udarda and Old Kalena Pradipaga Shushkam, that one which is ripened by itself, it shed down, that this bhala you should take and you shall to make Shira Kashaya and you can take. That is Shira Kashaya. Yashti Madhu also told in the case of urticarial lesion. So Madhu Yashti Swadhurisam Shita Pitta Vinashini. So in the allergic conditions you can use. Agrimanta also you can make use of the same way. Mahanimba, I think while coming, so many Mahanimbas I have seen. So Mahanimba, Kadudikta Shida. That one is Sarva Kushtani Chardimcha Pramehamcha Visujigan Mushigasya Visham Gurjanashe Kodharogam Karsharogam Shwasam. So almost all conditions of Visha, all conditions of allergy, you can make this of Mahanimba Kashayam. Okay, as a single track you can use. And again, Guda Amalaki Prayogam, Guda and Amalaki, Saguda Deepikam, Guda along with the Jiraka. All along with Guda is useful for Shida Pitta Uddata condition. Kadugi, again you can use for the Visha conditions. Kulakadi Kashayam is markedly available. Very good conditions to treat the Visha condition and also underlying Visha, like all skin conditions, allergy conditions, you can treat. Only 8 drugs are there.
പിന്നെ ഇങ്ങനെ ഇയർലി എന്തോ ഒരു പീരീഡിൽ വരും റിപ്പീറ്റഡ് ആയിട്ട് എന്നൊക്കെ കേട്ടിട്ടുണ്ട്. അപ്പോൾ അതിനെക്കുറിച്ച്
we are not treating well. The Visha is not completely eliminated in the body. It retains as a Lena dosha. And whenever the favorable conditions according to our food changes, diet changes and climate change, the same Dushi Visha what we told, no? Its favorable condition comes, it's again and again comes. So when we are treating, you treat it. Nowadays, actually fungal infections are very, very common. Same presentation that of Luda Visha. But how we differentiate is, in the case of Luda Visha, the elevated patch with the Mandalagara elevated patch. But the whole lesions are the same. Actually, all small pidagas around its elevated portion. But in the case of a fungal infection, again round patch, but the central portion will be clear. And in the margin, pearl-like arrangements you can see. All the fungus will eat the cell and it will go round. And this all deposited in the active fungus you can see in the this margin. Same presentation in the plague psoriasis you can see, but you have to see again in the margin. Margin will be rolled out. It will round margin with elevated patches. So these three always confusing. So just examine very, very clearly. So Luda Visha, same elevated patch, Mandalagara, but all pidagas very clearly. But in the case of psoriasis, the margin will be rolled out. But elevated, not much pidagas you can see, but you can see the elevated mark. But in the case of a fungal infection, central will be clear, but in the margin will be more fungus. So you have to treat it, even though fungal, even though Luda. Anyway, you have to treat it completely. In the fungus, in our body the fungus are there, but where there is more humidity, more heat, the fungal will grow very fastly. It spread from one person to another. Luda won't spread from one person to another. It's not contagious, but fungal is contagious. So, and also same another presentation on the flexural psoriasis. In the fungal infection, in the flexural areas, it's coming in the axilla, in the groin region, at the mammary, under the mammary gland. So here also what you have to examine, just see the margin. In the flexural psoriasis, the margin is not elevated. It will be same presentation, same thing, same itching, but no scale in the flexural psoriasis, but we have to examine the margin. Same thing, okay. So if you are treating fungal infection, you have to give Krimihara line of treatment. Nirgundyadi Kashayam, Krimikramadika, Krimishodhini Gulika, like that. In the case of psoriasis, as we have to do the Shodhana properly, Kshalana. But in the case of Luda Visha, Pitta Kapahara line of treatment. More emphasize, give more on Pitta Dosha. Okay, so just examine it clearly and find out.
നമ്മൾ ഒരു പർട്ടിക്കുലർ ഫോർമുലേഷന് കഴിക്കുകയാണെങ്കിൽ ഇൻസെക്ട്സ് ബൈറ്റ് ചെയ്യൂല എന്ന് കണ്ടു. അപ്പം അത് മിത്തിക്കലാണോ അല്ലെങ്കിൽ അതിനെന്തെങ്കിലും ശാസ്ത്രയോഗത്തിലാണ് കണ്ടത്, പക്ഷേ കുറച്ച് ബാക്കിലേക്ക് എനിക്ക് പേജ് ഒന്നും ഓർമ്മയില്ല. ഉള്ളിലേക്ക് കഴിക്കുകയാണെങ്കിൽ സ്നേക്ക് ബൈറ്റ് ഒരു വർഷത്തേക്ക് ഉണ്ടാവില്ല. മാം അതേപോലെ ചില ടൈമിൽ ഇൻസെക്ട്സിന് പോയിസൺ ഡോമിനൻ്റ് ആവും. ആ ടൈമിൽ കടിച്ച് അമാവാസി അതിൻ്റെ ഒക്കെ
നമ്മൾ നമ്മളുടെ വയസ്സിന്റെ കാര്യം പറഞ്ഞാലാണെങ്കിലും നമ്മളുടെ ബാലം കൗമാരം okay, in the case of age or in the case of day, we are telling in the morning that kapha, evening afternoon pitta, evening vada, like that. The same way, it's like season also, the dosha predominance will be different changes will be there. In Ushna Gala, the poison condition will be more, okay, and in Shita Gala will be less. But if Kapha Pradhana Kida, it will have more Visha. And if that particular kida is so hungry, it may bite. Okay. And also, as he told, along with the Jyotisha, we are having a particular post in Jyotisha. Like one portion is like Duda Lakshana and Amavasi Lakshana. Because all in particular Visha is having elevation. It's a chapter we having. I think we have posting there at Avanaparama Maheshwaran Namburipada. Actually, he was seeing all these things and he is treating. And he is telling every morning by 4 o'clock he will get up and he coming to for treating the patients. And he will tell, today is this Rashi, today this Graha is coming here. So there is a chance of one Mandali Visha is coming today. Surely one person may come to that. Because he is seeing very nicely and he having one preparation Vishahara Lehya and Vishahari Lehya. So he is giving the patient. If it is cobra bite kadurasam, if it is madura viper, and it is no taste, no visha, and while giving that, he is identifying the snake and he is treating the medicine, giving the medicine. So, having role, actually he is treating according to that. Okay. Okay.
Now, I requesting Dr. Sinachi Nair, Vice Principal of Emmanuel Arasar Ayurveda Medical College and Hospital for the felicitation of Ashwathi ma'am.
And I request our principal to honor. I request principal sir to honor Dr. Ashwathi madam memento.